We've set up hospital clusters. You have an acute hospital and then you have tier 2 hospitals around them. They're typically, right across the country. I mean, do you think that additional non-COVID capacity it would be better developed in the acute hospital, or is there a role to play for the tier 2 hospitals and greater care being provided in those?
The tier 2 hospitals are hugely important. They get through a lot of less complex work, and they get people care. The best care is closest to home when you can do that. So they need to be supported too. But as has been frequently referenced, we run the public system at a 90% plus capacity now. With social distancing, that comes down. With the IHCA said they want it to be 80% maximum. So our throughput's going to be shredded. We saw in the IMO submission 50%. That's probably about right. It's probably at the higher end if we're trying to go from 40 patient clinics to 30 to 15 or 20 patient clinics. So we're going to need a lot of capacity and a lot of footprint and a lot of flow, more than what we already have. The level 2 hospitals are also cramped, overcrowded, and they need capacity and modular build just as much as the level 3 and level 4 hospitals.
But we're repeatedly told that there's at least in some level 2 hospitals, there's a difficulty in getting consultants to go out to those tier 2 hospitals to carry out procedures. Is that something that maybe the Hospital Consultants Association might comment on?
Yes, and I've seen some commentary to that effect, and when I've checked it, it hasn't always turned out to be correct in terms of the reflection, and in particular, I'm aware in the Midwest, your own particular region, Deputy and Chair, there were commentaries to the effect that consultants weren't going out, but in fact, when I checked, there's a long list of consultants who go out to practice. I think the bigger issue here is there are restrictions on the type of procedures you can do in Model 2 hospitals, Model 3 hospitals, depending on the support facility you have. There are absolutely a range of procedures you can carry out, but some of the rest has to be done in the more centres with high levels of support.